Our health system cannot withstand an upsurge of infections in this kingdom, and neither are our resources adequate to manage an uncontrollable transmission of the virus. It is for these reasons that, after wide consultations, government has taken the decision to remove the relaxed measures of the partial lockdown with effect from Friday, the 24th of April 2020. Therefore, the following will apply. In line with the COVID-19 regulations, the Ministry of Commerce, Industry and Trade will issue revised guidelines regarding certain business operations. Guidelines of the relaxed operation of public transport are removed. A new set of transport guidelines will be announced by the Minister of Public Works and Transport. All the measures effected at the start of the partial lockdown on March 27th continue to be in full force. These include non-essential travel between communities, towns, cities and regions is strictly prohibited for all citizens. All public and private gatherings exceeding 20 or more people are prohibited. Citizens and residents returning home from abroad will be quarantined for 14 days. Visitation to hospitals is restricted. Workers in non-essential services should work from home. Our security forces will be vigilant in enforcing compliance to these preventative measures to help the country buy more time to strengthen our response and capacity to flatten the curve. Government has taken lessons from the experiences of other countries across the world to deal with this unprecedented time in our history. We are all learning on the go, and as a result, now and again, government will review these measures to adjust to the situation on the ground at any particular time. We are aware of the negative effects of COVID-19, hence we will adapt and respond effectively to preserve the lives of all Eswatini. We all have to take full responsibility of our lives and that of our families, communities, and the country. I appeal to parents to lead by example and stay at home. No child and certainly no adult should roam out of the precinct of their home for any reason beyond seeking food or medical attention. While necessary, the partial lockdown has come with consequences for our economy and more particularly for the most vulnerable of our society. For some Eswatini who were already struggling to have a frequent supply of food, this calamity has exacerbated their daily struggles for adequate meals. Over the next 2 weeks, government will implement the following interventions. Provide food assistance to the most vulnerable of our society that have been adversely affected by COVID-19 pandemic. The food assistance will benefit over 300,000 individuals from 63,000 households across all 4 regions of the kingdom. Government will ensure availability of face masks to minimize the spread of the virus. We will increase the number of ventilators available in the kingdom to assist COVID-19 positive cases. Over 1,000 scanners will be made available to help upscale the screening process. Government will intensify screening and testing for COVID-19 symptoms. intensify contact tracing as an important element of identifying potential cases in order to curb the spread of the virus. Increase provision of personal protective equipment for health workers. We are cognizant of the shortage of PPEs due to limited international supply. Government is intensifying the processes of sourcing PPEs and has encouraged local suppliers to produce some of this equipment. The water, sanitation and hygiene sector is also supporting interventions to rehabilitate non-functional water points and expand reticulated schemes. While we recognize the emergency, the approach is sensitive to sustainable approaches to ensure that benefits last beyond the emergency and COVID-19 response. Government remains firm and committed to addressing the health and economic challenges of COVID-19 to protect the lives and livelihoods of Eswatini. The following steps are underway. Government is working on an economic response plan post-COVID-19. Government is in the process of getting loans from various international banks towards COVID-19. The electronic payment of the elderly grant is progressing well. The central bank has reduced the repo rate by a further 100 basis points. This reduction allows businesses to get loans at lower interest rates and leaves more money in the pockets of consumers and businesses. We are working on increasing the number of ICU beds for a possible increase in the number of people requiring admission. Government is determined to pursue relevant and practical avenues to dampen the economic and social impact of the partial lockdown in the midst of the pandemic. The Ministry of Health continues to study the spread and effects of the novel virus across the country. We now know from recent studies that a significant portion of individuals with COVID-19 lack symptoms, and that even those who eventually develop symptoms can transmit the virus to others before showing symptoms. This means that the virus can spread between people interacting in close proximity. For example, speaking, coughing, or sneezing, even though they are not exhibiting symptoms. In light of this new evidence, government recommends wearing mask or cloth face coverings in public settings where other social distancing measures are difficult to maintain, especially in areas of significant community-based transmission. It is of critical importance to emphasize that maintaining social distancing remains important to slowing the spread of the virus. The Ministry of Health is additionally advising the use of simple cloth face coverings to slow the spread of the virus and help people who may have the virus and do not know it from transmitting to others. Cloth face coverings fashioned from household items or made at home from the common materials at low cost can be used as an additional voluntary public health measure. The cloth face coverings or masks recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders. My gratitude goes to our frontline staff, the health workers who are leading the charge in the fight against this virus. We acknowledge the dedication and commitment for which they have taken this task in their stride under trying and demanding circumstances. May I, on behalf of His Majesty's government, pass our sincere gratitude and appreciation for their devotion to a noble cause. Our appreciation is also extended to all workers in essential services who continue to risk their lives to keep our economy and livelihoods safe and enduring. I can never overemphasize the importance of maintaining good hygiene to fight this virus. By following the precautionary guidelines as provided by the Ministry of Health and the World Health Organization, we will win this war.